Really an honor to be here, Mr. Chair, members of this committee. I think it's actually exactly 13 months since I was here last time testifying before the Judiciary Committee. So it's really good to be here now with the Finance Committee. I'm here from Denver, Colorado. I'm the Chief of Staff and Senior Policy Advisor for SAM, Smart Approaches to Marijuana. We're the leading national organization opposed to the commercialization of marijuana. Our work is guided by a scientific advisory board, one member of whom maybe you've heard from, Dr. D'Souza, who's here from Connecticut and does excellent work on the topic of marijuana research. And really, we want science to guide what we do. And looking at the question before the committee today, I think it's an interesting one. I'm a little, I was reviewing the bill and I was a little confused about, operating on revenues that are obtained from, legalization, but legalization I don't think is included in this bill. So a little convoluted process to me, but it seems like there's multiple parts. Being from Colorado, I feel like I can comment on a number of things from a first-hand basis on how legalization goes. Just looking from a revenue perspective, I think it's important we listen to the governors of legalized states who have had some really, I think, illuminating comments on what the tax revenue is like. So former Governor of Colorado, John Hickenlooper, he's now running for president. He's for legalization of marijuana, but he says, quote, "Do not legalize marijuana for the revenue. It is a drop in the bucket." And then if you go to California, former California Governor Brown, he also said they never once counted on getting any kind of revenue from marijuana taxes. So you have two governors of two legalized states who maybe have varying views on legalization. Maybe they're pro, but they say don't do it for the money. And if you talk to members of the administration in Colorado, they will also tell you don't do it for the money. So let's look at what the numbers are. We're talking about less than 1% of the state budget for any of the legalized states. That's right, the marijuana tax revenue in Colorado is 0.78% of what our state budget is. The marijuana tax revenue in Oregon is 0.4%. So we're talking about pennies. And I think the goals of this bill are noble and programs that absolutely should be in place. I don't know why we can't have a conversation about putting those programs in place without legalizing another recreational drug. It seems to me like those two are not mutually exclusive. So that would be my encouragement to the committee, for whatever my 2 cents are worth, is we should pursue these aims without legalizing another drug. Speaking to kind of some of the other aspects of this, I think the black market impacts the revenue scenario as well. The New York Times, I don't know if any of you read it over the weekend, but the New York Times had an interview with the current California governor, Newsom, who said the black market and the cartels are getting worse, not better, since legalization. That's a direct quote from him. They've called the National Guard in California to contend with the cartels that are taking over in that state. And I can speak to that from personal experience because we have 3 major foreign cartels from 3 different countries that are setting up shop in our national forests in Colorado right now. Black market marijuana grows. So this is impacting the bottom line. I think it has tremendous relevance for the discussion today. Excuse me, a little sick. And I'm happy to answer any other questions on this. Would love to have an open conversation, as I think I may be the only person here from a legalized state.
Thank you, Luke. Can you care to share with the committee how Smart Approaches to Marijuana is funded?
Yes. So our funding is all from individuals and a couple of small family foundations. We take nothing from any industry, whether that's tobacco, alcohol, pharma, et cetera. We refuse all those funds, which is why we're much smaller than probably we could be if we accepted those funds.
Great. Thank you. Representative Candelora.
Thank you, Mr. Chairman. Thank you, Luke, for your testimony. This committee obviously is charged with how to spend that revenue if and when it comes in. And if you could speak to that, right now it's pointing toward community development, but what would you recommend that we should be paying attention to as a state to mitigate or deal with the adverse impacts of marijuana?
Yeah, absolutely. So, there's actually only one study in Colorado since legalization that has looked at the costs of what the state actually pays since marijuana legalization. And that study, it's a 92-page study conducted by the Centennial Institute, which I actually referenced in my submitted testimony. But it found that for every dollar in marijuana tax revenue, the state is paying $4.50 in costs. So how do we quantify those costs? There are a lot of things that go into this that some we can't quantify and we simply can't put a number to, but some we can. The cost of a human life has a hard cost, especially on the road. We know that from the Department of Transportation, that it's about $3 million per life. We look at the healthcare costs. We know that in Colorado and other legalized states, they saw triple-digit percentage increases in ER and hospitalizations. So, Colorado saw a 200% increase in hospitalizations since legalization. We know that that has a significant cost. Then if you factor in the fact that, maybe the patients don't have insurance, or maybe the patients are on, some sort of subsidized program, that has an impact to the taxpayer, to the government. You look at, obviously, property damage. You look at property crime, which some recent research out of University of Colorado is finding that property crimes go up around pot dispensaries. All these things have costs we have to consider. Now, some of the costs we can't consider that I think this committee should think very carefully about are the costs of treatment, costs of increased addiction. Cannabis use disorder is a real thing. Cannabis use disorder, I think, the guy who's here from the Hospital Association, he's probably got the actual digits of how many cannabis use disorder codes are diagnosed every day in their hospitals, but that is legitimate, and we have to treat that. So those are all things that I think this committee should think about. I think also you have to factor in the societal cost of having a for-profit, multi-billion-dollar industry, which is what came into fruition in Colorado and elsewhere, that is setting up its shops in areas that are most vulnerable. And I think that is particularly concerning as well.
And can you just speak to that after this does pass, we have medical in this state, and so we constantly see a push to change the way the program's implemented. So we have a medical program, we have a board of physicians that recommends what illnesses should be treated, but every year now we're having bills where lobbyists come in and say, we want you to leapfrog that process and legislatively expand the program. Could you speak to that and what impacts does that have on Colorado?
Yeah, I think what you see with expanded commercialization, and I think that's what you have to understand, is we're not talking about, people are going to grow plants in their own home and it's going to be a mom and pop shop and it's all going to be local. We're talking about a massive commercial market. And the impact of that is you have a whole new kind of approach where there's the incentive line for these for-profit companies is to maximize use. So there will be more use because their bottom lines depend on it. Now, I came from the digital health background. I started a digital health company and sold it, and started another one as well. And if I went to my board of my company and I said, hey guys, we raised, $10 million, the onus would then be on me and my company to deliver them a return on that investment because we're a for-profit company. So our responsibility is to our shareholders and our investors. And nowadays, when you look at these brand new industries in this economy, the return on investment they want is 10 times. 10x is what they call it. So how do you get 10x in return on investment on a $100 million investment like what we're seeing from some of these major industries into the pot industry? Well, you got to sell a lot of marijuana, and you got to find new users. You got to get them addicted. If you look at the alcohol industry, their model is, you have about 10% of the users making up about 75% of their profits. So that's very heavy use in that cohort. We're starting to see that now in Colorado, where 20% of the marijuana users are making up about 70% of the use in the state of Colorado. So very heavy use, and we know that heavy marijuana use has a significant impact. Not only on the youth, but on the adults as well. Permanent IQ loss, 6 to 7 points, psychosis and other issues, major public health harms. But notwithstanding from this conversation, we also have to look at the workforce aspect. So Quest Diagnostics, I'll finish this comment. Quest Diagnostics just did a big release 2 weeks ago. And they found that every single state that legalized marijuana has double-digit increases in workplace positivity results for marijuana. 63% in Oregon, 47% in Colorado. We're talking massive increases in positivity rates for marijuana in the workforce in legalized states. And that's from Quest Diagnostics. Those are the guys who do all of them. So it's very, very concerning.
Representative Yacarino.
Thank you, Mr. Chair, and thank you for being here. And I apologize for walking in late. As far as Colorado, how are the schools doing the education, and is money going toward education and to prevention?
Great questions. So that was the number one thing we were promised in Colorado when we voted on this in 2012 was that we were going to get all this money for education. Everyone was really excited about it. A lot of my friends voted for it simply on that notion alone. Unfortunately, it hasn't worked out that way. What we have now is just 2 months ago, Denver Public Schools, their entire teachers, all the teachers in Denver Public Schools went on strike for the first time in 3 decades because of lack of funding, lack of pay. So we aren't seeing that windfall for education that we were expected. And there's been a lot of consternation. Actually, the superintendent for Cherry Creek Public Schools, which is the best performing school district in Colorado, I actually went to high school in that district. The superintendent said, we have not seen any of the marijuana tax revenue that we were promised. And that's straight from his mouth. So the money that has gone from marijuana taxes to education has been tremendously small. And it hasn't really fulfilled what the promises were.
Do you live in Colorado? I
Yep,
apologize.
I live in Denver, Colorado, yes.
And obviously you're passionate about this, you wouldn't be here.
Yeah.
So you had mentioned, I think Vermont, was it Vermont or grow your own and your?
Oh, I just had mentioned, I think just use, I hadn't mentioned any state.
Oh,
but yeah.
I will. They do it in Vermont. It seems like it's working there, but it's totally different model. If you grow your own, you have to get a permit for it. Can't, it's very condensed, and you still have the medical.
Yeah, Vermont's a very different model. So a lot of folks refer to Vermont as a legalized state, but we don't really consider it that way because they haven't commercialized. They don't
Right.
allow production and sale. It's strictly, within your own home, and that comes with its own set of unique challenges. That I don't think this committee is really considering, but
Right.
we have reservations about that model. But certainly, it's much better than allowing, Big Tobacco 2.0, which is what's going on in Colorado.
Yeah, that's
right now.
my fear. It's
Yeah.
just that, we'll see what happens.
Yeah.
But the fact show in Colorado, back to that last question, is the money hasn't gone where we're supposed to go.
Yep.
It was promised to go there, and it still continues not to go there.
Right, and that's not to say that these government administrators are these crooks that are stealing the money from us. What the point is with that comment is the money is not even close to what was promised by advocates. It's a fraction of the state budget, and secondarily, it came with costs. And we never had an honest conversation about those costs. And so I would hope that, as any public servant, you would want to hear both sides of the scenario. And if somebody says to you, you're going to get all this money out of this, I think, naturally speaking, we'd want to know, well, what are the costs first?
Anything like this, you have to roll out slow or be very careful and cognizant of what the cause, and there's always cause and effect.
Absolutely.
And no matter what it is. Thank you for being here. Thank you, Mr. Chair.
Thank you.
Thank you. Senator Logan.
Thank you, Mr. Chair. So just going back to some of your comments on regarding the black market and increased crime around pot dispensaries, there's some folks here in Connecticut who are in favor of legalizing marijuana for recreational use are under the belief that current drug dealers will then become legal business owners and dispensary owners. Have you seen that case occur in some of these other states that have legalized marijuana for recreational use?
So certainly, I think that, obviously you have this expansion of a legal market. But what has happened is, while we have a legal market in place in Colorado and other legalized states, we still have this black market. And the reason why is because, again, we're talking about revenue here. So everyone's thinking when they legalize marijuana, well, we better get some tax money out of this, right? So the more, depending on how quote unquote greedy you might get with the tax, that is going to be much easier for the black market to undercut. And so the comment's been made by a number of law enforcement members who are having to deal with this on a daily basis in Colorado that there's no way with taxes involved you can beat the black market price. And so there's always going to be a black market involved. We're not going to get rid of it completely. And unfortunately, what we're seeing in all the legalized states is that the black market's gotten worse. So that is a concern. And then the other aspect of this is that you have the cartel involvement and gang involvement, and these gangs don't just go away. The cartels don't just go away. They don't put down their weapons and become law-abiding citizens. We know better than that. So legalizing marijuana doesn't solve that problem. If anything, it's just kind of, I think, creating a whole other ball of wax.
And you mentioned schools and education from sort of a revenue standpoint, where the thinking would be that utilize all these marijuana revenues to help programs out and school districts out. One, as you pointed out, the amount of revenue generated is particularly de minimis, if you will, compared to the 20 billion plus state budget that we have. But what about, forgetting the revenue aspect of it, how about our children? One of my priorities is children K through 12, and some of the information I've read some information from your organization, but from others as well, that the use among children. I'm talking about middle school,
Yeah.
high school. In every state that has legalized marijuana for recreational use has gone up. What do you have to say to that?
Yes. So first of all, I'm raising a 2.5-year-old daughter in Colorado. So the youth impact is something I live every day. The reason why I'm a part of this organization, if you'll excuse my anecdote for 1 second, and I'll answer your question, is because every time my wife and I take my daughter out for a walk down the sidewalk in Denver, and we live in a nice, peaceful area of Denver, in her stroller, she is particularly deluged in marijuana smoke. And she breathes that in, that secondhand marijuana smoke. And there's nothing we as parents can do about that because it's everywhere we go, it's in public, and the use is so prevalent. So there is absolutely an impact to the youth that we cannot ignore. They tell us it's this regulated market, but you can't make everybody follow the rules. And we know with cigarette smoke, we have enough of a problem with that, and then now we're going to layer on another smoked drug on top of that. But to your point, use is absolutely going up. We've seen actually in legalized states, particularly Colorado, 12 to 17 particularly is going up 2% according to the National Survey on Drug Use and Health. That is of particular concern. Number one offense in public schools in Colorado by a long shot is marijuana-related offenses. So our teachers are experiencing that. Folks don't know what to do. It was interesting. I was talking to a kid in high school the other day, and he was telling me that he has one of those new Juuls, the little vape pens to vape nicotine or marijuana, and he was vaping weed, and he was laughing about it because he said his teacher couldn't tell he was vaping weed in class. So that is the reality that our schools are having to deal with. And right now, Colorado, you could actually read an editorial from the Denver Post just yesterday. They released on the vaping epidemic in Colorado. Vaping is through the roof in Colorado, and they don't know how to get their arms around it. But one of the comments in the editorial was, we've got all these lobbyists pushing to make sure that this stays normal. And that really made my alarm bells go off, because I thought, we've got a ton of lobbyists that are pushing marijuana use and pro-marijuana industry regulations in Colorado right now. And it's not a good, those two things are combined.
You mentioned the statistic, marijuana use going up 2% amongst children in Colorado. How about other states that have not legalized marijuana for recreational use? Has the use of marijuana been trending up or down in those states?
So overall across the country, we're seeing drug use is going down, which is a good thing. We're seeing a very good trend there. But marijuana is the one drug that is not trending down across the country. And that is a particular concern. If you look at the National Survey on Drug Use and Health, we see great gains with cigarettes, great gains with alcohol, but among our youth, marijuana is starting to take a slight uptick now. So that is very concerning.
Thank you.
Mr. Chair, if I can entertain one more question? Is that
We're
possible?
trying to adhere to the 5-minute rule,
Oh, okay,
Senator,
that's
but
fine.
thank you.
Thank you.
You're welcome when the questions for this witness are concluded to come back if you like, Senator. Representative Mashinsky.
Thank you, Mr. Chairman. 2 questions. My sister's an MD in Denver, and she's been telling me that the edibles are a bigger problem for visits to the hospital. And so my 2 questions are, has any money been set aside for regulating the THC content in edibles? And then has any money been set aside to prevent or treat drug abuse from the incoming revenues?
Excellent question, and the reason why I smiled at your first question was because it just seems so reasonable. To regulate the potency, it just seems like such a rational thing to do. We tried to put a potency cap, because right now, for those of you who don't know, Woodstock days, 1970s, your weed potency was 2 to 5% in a joint. Now we're talking about completely unlimited potency, all the way up to 99% potency, concentrates, shatters, waxes, etc. And that's dominating the market in Colorado. So we thought, maybe it'd be a really good idea if we at least regulated the potency, right? Maybe capped it to somewhere within the realm of the weed that we have a lot of experience on, or research on. So we tried to put that on the ballot. The industry was very wise, and they hired up all of the signature gatherers in the state, so we couldn't hire anybody, and they effectively shut that down. We have tried to push that in the legislature and been shot down every single time. So there is very little appetite from the industry lobby to have any form of cap or potency or kind of regulation around potency. So no, there are no funds that are dedicated to that edibles and potency aspect. In terms of for addiction and the other part of your question, there were some funds that were set aside, that were supposed to kind of help with education about marijuana use, particularly help with some treatment. But a lot of the treatment providers we're hearing from are saying either they aren't receiving that money or it's been very little.
Okay, thank you.
Thanks.
Sorry. Representative Wood?
Thank you, Mr. Chair, and thank you for being here today. A couple of questions. One, how many states started with a medical marijuana program and then went to adding in the recreational marijuana program?
I believe all of them.
So all the states started with medical marijuana and moved on to, because my next question was, if they started with the medical marijuana first, was there anything that starting with that first moderated the negative effects of the recreational marijuana?
In other words, are you asking if they learned lessons from medical and then applied them in recreational? Unfortunately, with the medical side, some of these medical programs have been very open-ended, but still the patient populations are small. So what you see with the recreational program is just so completely different than anything you can encounter with medical. It's just while the profit model's the same, the business and investors are all the same, and the products are the same, which a lot of people don't know. I think people think medical marijuana is different from regular, and it's just the same. But in terms of the policy making and the regulations, Colorado had no idea what it was getting into, even though it had medical.
My understanding is that there is a chemical difference between the medical marijuana. There's a lower level of THC in the medical marijuana.
Not by definition, although different laws are different states have different laws on it. Maybe they have. To my knowledge, there's no limit on potency in this country in any program. I would be if you all have done that here, I would be fascinated to see it. But they really tend to push back on any kind of potency limit.
All right. Last question is, do car insurance rates go up in states that have recreational marijuana?
That is a great question. So I just spent a year and a half living in D.C. and made my way back to Colorado, and I was reminded of that particular issue. So it absolutely impacts your wallet. So the car, Denver Post had a really nice write-up on this, but car insurance rates are 50% higher out of pocket what you're paying in legalized states versus non-legal states. And I will give you a personal anecdote.
It's just right across the board.
Across the board, yeah. Legal states versus non-legal. And you can look me up on that. So, but I'll give you a personal anecdote on this. So we lived in Virginia. So we moved from Denver, Colorado to Virginia. We were paying $250 a month for our car insurance in Denver. And switching to Virginia, we were paying $100, almost even $100. Per month. It was astounding. And I just moved back and it's gone up even more. We're paying almost $300 a month now in Denver, Colorado, after coming from Virginia. So the costs are extremely, and it makes sense because it's a risk-based scenario and there's much more risk.
And that increase in rates is directly tied to just marijuana. There are no other factors involved. Population growth.
If you looked at just Colorado, they would say that we have a tendency to have a bunch of hail that damages cars. So that is another factor that's at play. But from when legalization happened to now, the cost has gone up significantly. And then if you balance that across the other states that legalized, which don't have those problems, you still have a much more significant increase.
Thank you very much. Thank you, Mr. Chair.
Thank you.
Thank you, Madam. Representative Cheeseman.
Thank you, Mr. Chairman. Thank you for coming here today. We're talking about revenue. And you mentioned that the predictions of the revenue to be gained have gone down. What about the effect on other industries? I've read anecdotal reports that the convention industry, for instance, is now steering clear of Denver because people coming to the conventions don't like what it's done to the downtown life.
Yeah, so 16th Street Mall is kind of the central business district downtown in Denver. It's kind of a charming place everybody goes to. It's very much the character of downtown Denver. And there's the convention center is there, and there's a number of other major hotels that are there. And 16th Street now, I'll spare the hyperbole and descriptions I've heard, but it is a total epicenter for marijuana use, secondhand smoke, and a whole lot of other, tertiary things that come with it. It's become a totally radically changed environment to what it was maybe even 10 years ago. So that has been sad to see, but you're right. The complaints from people who are putting on conferences down there have been significant. In fact, it was the #1 complaint on Denver City's website a couple years ago, which was kind of embarrassing. But a lot of people have switched locations for their conventions. Another interesting thing is that the biggest construction employer in the state, GE Johnson, has said that they can't find employees in Denver to pass a drug test. So they're actually importing labor from out of state, Nebraska and Wyoming and other states to fill those jobs. So it has absolutely been an impact on our local, not only employment, but also in just even events and tourism.
So any revenue, which obviously seems to have been overestimated, that you might gain is also going to have knock-on effects in terms of revenue that will be lost because of this knock-on effect on other businesses.
Absolutely. And I've talked to a number of folks in the hospitality industry. In fact, I was actually staying in a hotel in DC, and I was talking to the manager at the hotel, and she said, man, I couldn't work in the hospitality world in Denver. I lived there for about 6 months. She moved because she said everyone that they were trying to hire was, using marijuana. They could smell it in the hotel rooms. It was unlike anything she'd ever seen before.
So many good reasons not to do this.
Absolutely. And I think that these programs are so impactful, what's being discussed in the bill. It just seems to me like I don't know where, legalizing another recreational drug came into play, but I don't know why we should marry noble ends with harmful means. It seems to me like piggybacking taxes off the backs of folks who are using a harmful substance is a really, really bad idea.
Okay, thank you for your insight and for coming today. Thank you, Mr. Chairman.
Thank you.
Thank you, Representative Rojas.
Thank you. I wasn't here for the beginning of your testimony. Just can you say your last name so I can
Yeah.
at least address you correctly?
Niforatos.
Niforatos. Thank you.
Good,
Thank you
got
for your
it.
testimony. I
Nice.
appreciate you
Yeah.
being here today
Yeah.
to offer certainly your perspective.
Yeah.
I just want to start off. I don't know that I've heard a colleague say that we're doing this for revenue. And I know that continues to be said. This is certainly a revenue source, not some revenue savior. And I don't think anybody in this legislature is under some illusion that somehow it's going to save the state from some of the fiscal challenges that we have. So I guess I want to begin there. But it is a revenue source, certainly, especially with Massachusetts doing what it's doing. And for those folks who have driven up there and see the number of Connecticut license plates sitting in the parking lot there, we imagine there's some revenue migrating north, given that it's legal there and not here. And in your testimony, you referenced a report done by the Centennial Institute. Can you tell us a little bit about that organization?
I guess it's an organization. It's a policy organization based in a school called Colorado Christian University.
Yeah.
I don't know what else you want to know from it.
So I'm on their website, and they bill themselves as taking conservative viewpoints on all these issues. Is it possible that the outcomes of their report more reflect their conservative viewpoints than some actual...
Certainly it's possible, but so here's the issue I have is I would gladly use from, we're a nonpartisan organization. I don't really care where this comes from as long as it's credible.
Sure.
I believe that their report, it's a 92-page study. It was done by a third party, not by their organization. They commissioned it to be done. I think it's pretty credible. However, there's no other...
I'm in no
Yeah.
position to discredit
Yeah.
it.
Well,
It just struck me as interesting.
Yeah, and so
That's
in my
all.
comment on that, I think it's a fair point. And if there was another study to use, I would be using it. Unfortunately, there are no other cost studies that have been prepared on kind of a comprehensive look at what are the costs the government pays. So this is the study we have until another one comes, and we certainly would like to commission one. But I think you'd be asking me the same question: isn't your organization opposed to the legalization of marijuana? And then we'd be right back here. So,
But at least you're clear about that.
yeah, it's a fair point, though.
Yeah.
It's a fair point.
Well, good. And I just Googled quickly, Colorado marijuana utilization, and almost all of them talk about youth usage. And even as recently as July 19, 2018, this is Denver CBS, 2 studies indicate that the rate of usage by Colorado young people has unchanged since 2015.
Yeah.
Is that true or not?
So that is not true. So what that's based on is a survey called the Healthy Kids Colorado Survey, which is done by the state government. And that survey is not accepted by the CDC as a representative sample of the state because it excludes 3 of the top 5 most populous counties in Colorado. So what we rely on is the National Survey on Drug Use and Health, which is the national survey. It is the most respected survey on drug use and behaviors. And so that's really where we would derive our data from.
So is this press release from the Colorado Department of Public Health also inaccurate too?
It's inaccurate based on its assumptions on youth use because they're using state level data that have literally not been, they've been invalidated by, the methodology has been invalidated by national and international bodies.
So the Colorado Department of Public Health has some pretty big issues on their hand if they're
Well,
putting
I
out
think that-
inaccurate information like this that
So I don't
says
think that-
Colorado use rises for adults but stays the same for kids.
So I don't think that they are, I don't think they're intentionally misrepresenting the truth. I think that they are relying on data that has been criticized for not being representative. They maybe feel that that's not the case, but when you look at the top 5 counties, 3 of them are not included in the sample size. So I don't know what else to say other than that.
Got it. Okay. And then, so there's a host of other news organizations in this Google. They all got it wrong. Washington Post, Denver Post, all of them got it wrong.
Well, I mean, I can't argue with Google, but I do think that
I'm not arguing. These are news. These are actual news sites, not Google
understand.
telling me this.
I understand, but
Yeah,
here's
okay.
here's the issue we have is you have a state-run program with state administrators who are not going to come out and say, and to their, I get where they're coming from. They're not going to come out and say, hey, we're doing a terrible job. All the kids are using it. Our regulations stink. You should vote us out of office because we're doing such a poor job regulating this program. So I completely understand that they're going to position and use the best serving data that they can. However, I think that it's important that we look at all of the data sources that are out there. The national surveys on drug use and health have been the standard for this, and they are showing an increase. And I think that we've positioned that to Colorado legislators. Some of them see that as very legitimate, and they question what the Department of Public Health and Environment is doing. But others of them, they've got a job to keep.
So you're suggesting that career civil service employees at the Colorado Department of Health are suddenly engaging in some kind of partisan battle about legalization of marijuana?
I'm saying that it's a natural and understandable human instinct and something that we see in governance, that they're going to find the best looking data they can find and they're going to use that. And it's a perfectly
your
good
organization
study.
could do the same, probably?
Absolutely.
Okay.
So what we have a question is no one's going to deny their bias, but we have to look at all the data that are available.
And given that in Colorado it was legalized in 2014, so it's
14 is when it went live.
so it's been
yes.
about 5 years.
Yeah, about almost 6.
Is
Yep.
it possible that it's a little too early to be determining causal relationships between something that's happened and where we are with data?
Absolutely. And so that's something that I would say is, I think there are some things we can, without a doubt say, like marijuana impairment, hurts your ability to drive on the road and, will cause a crash, will cause you to be more likely to get into a crash. I think we can say that for certain. There are other things that I think we absolutely do need a lot more time to understand. If you look at tobacco, it took us 100 years to get that industry under control. We're still beginning to understand, just now we're really beginning to get our arms around what that impact was of tobacco use across the population, and that took 100 years. I don't, think that we should rush into this right now. I think we can wait. I think we can look at what's going on in states like mine and really see what the results are. And I think the initial results are concerning, and that's what we're talking about today.
Well, thank you. Now, I appreciate, the back and forth here, and certainly you're sharing your perspectives.
Absolutely, and thank you for your questions.
Sure.
I think they were very fair.
Thank you.
Anyone else? Representative Doucette?
Thank you, Mr. Chair. So obviously, the cognizance of this committee is the revenue piece of it. So I guess I'd ask if your impressions of our tax rates, our pricing, and compare it to the Colorado model or any other states you're familiar with. I appreciate that you stated that Governor Hickenlooper said we shouldn't do it for the revenue, but obviously there is revenue there. So what can you tell us about the Colorado experience there and how our pricing or our tax compares to Colorado?
To be honest with you, I haven't done an in-depth dive into your tax rates and kind of how they compare to Colorado's. I know that Colorado has a 25% tax, which is significant. And, again, I think we see a black market, element to that high of a tax rate. But there are a number of states. Michigan has a 10% tax rate that they put. I think theirs is tied for the lowest for the legalized states. Right now, we're not seeing a magic number, for a tax rate that you can put that will eliminate that black market ability to compete. But in terms of a direct comparison between your state and another one, I'm not prepared to make that right now.
Okay. I mean, that's what I'm most interested in hearing about today. As you probably know, 2 other committees in this building have considered legislation. I think dealing with what most of the discussion has been here between you and us today. And certainly, I think there is a significant amount of revenue coming in Colorado and other places. And we could talk about how much is coming in, again, the pricing of that, what it's allocated towards, and whether or not it meets the expectations, as you alluded to, of the legislators and the governors of those states. Then you also, my second question, mentioned the black market. I'm interested again in your experience in Colorado, and you mentioned California. I think you would have to admit that those states, especially California, had huge grow operations and farms in Humboldt County and Mendocino County, and that our climate here in Connecticut does not lend itself to those sorts of operations, and perhaps that has something to do with the black market in those places. But I'm interested if you have a different perspective in how those states' experiences could inform us here in Connecticut on the potential for a black market.
Mm-hmm. Certainly, I think that's a fair point. I don't think that Connecticut's going to turn into California or Colorado for that matter. I think obviously you're a unique state. You're going to have unique experience. The black market, I think you could. Obviously, I think Connecticut's going to have its own version of the black market. But I can guarantee you one thing: it will have a black market because growing marijuana. It's interesting. I've heard. Obviously, you hear from both sides. You hear the argument that this is just like alcohol, right? When was the last time you had moonshine? We regulated alcohol really well. There's no black market virtually, and I think a lot of people think that sounds reasonable. But unfortunately, marijuana is a different kind of drug than alcohol, and it is a different. Growing marijuana is much easier. It's just much. And you look at Colorado, for example. They can gut a house and turn it into a grow house, and that's what they're doing. So I don't think that stops in California or on the western side of the country. I think that they'll bring that model to Connecticut, where they're purchasing up houses in suburban neighborhoods, gut them, fill them with marijuana plants, grow them up, do whatever they're doing, and then they ship them out, and they'll take them to other states. And so you will have a black market problem not only within your borders, but also exporting out of your borders. In Colorado, we export it to 32 different states. Number one black market exporter in the country. California, 6 to 8 times the weed they can consume. We would be foolish to think that no matter what kind of financial structure we put in place, that the black market wouldn't figure out a way to innovate around that, because they've figured out a way to do it thus far. I think that they're going to figure out a way around whatever the laws would be if you were to legalize it here.
But where do you think the correlation is between the black market activity and the legalizing of cannabis in Colorado?
I think it's part of it's demand. I think part of it is demand. I think part of it is obviously cost. But part of it is simply that you have a whole country, there are 50 states, 8 or 9 of them, depending on how you count, have legalized. There's demand in other states. They want to grow to new markets. In Connecticut, very centrally located, not every state out this direction has legalized. A lot of states are pushing back, New Jersey, New York, et cetera. All of them have totally stalled their legalization process. So there will be demand in states around, and there will be a black market to fulfill that demand.
Have you looked at the Massachusetts experience at all and
Yes.
what the black market is? So what do you observe there?
I mean, the black market still exists there. And on top of that, in Massachusetts, they've uncovered this huge discovery that the social justice aims that they were trying to do in Massachusetts didn't bear out, and now they're really trying to backtrack and solve that problem too. So there were a lot of intentions, I think, similar to that of this bill, but they weren't achieved in Massachusetts, and it's hardly the perfect example of
Well,
legalization.
I guess I wonder, my time is up, but I guess I wonder what you base those conclusions on, if you have any data, and I'd be willing to
Yeah.
have a discussion with you afterwards on that.
Great.
Thank you.
Anyone else? Representative Sanchez.
Thank you, Mr. Chair. Just a question in regards to preschool in Colorado. Have you seen an increase in special education services in the in Head Start daycare programs?
That is an excellent question. I don't know the answer to that question. I do know that for children in that age bracket, we've seen a significant increase, 400% increase in exposures to marijuana edibles. In other words, they've ingested them and been taken to the hospital.
Mm-hmm.
So that is a 400% increase there, and that was just released by the CDPHE just a couple weeks ago. But in terms of special ed and that kind of stuff, special needs, I haven't seen anything on that yet.
Okay, and K through 12, there has been an increase in suspensions in schools,
Yes.
right?
Yep.
Okay, thank you. Thank you, Mr. Chair.
Thank you, Representative Sanchez. Representative Carney.
Thank you very much. And thank you very much for coming up here to testify today. I apologize I did not catch the beginning of your testimony,
No worries.
but I just want to ask you a couple of questions related to Colorado and Connecticut. So does Colorado currently have an excise tax on marijuana? And if so, what is that?
I believe so, and I believe it's that 25% number I mentioned. I'm not sure, though.
25%. Okay. And how about a tax on medical marijuana?
There is a tax. It's less, so that's the loophole that's being used right now in the state. They're trying to close it. Is the tax on medical is less than that of recreational, so there are folks trying to kind of piggyback the system, and they're trying to close that loophole.
Okay, I appreciate that. And I just one other question, I guess, related to this black market issue. Are you finding that there are more folks being incarcerated at all in Colorado?
Yes.
Now versus in the past?
So overall arrests for marijuana-related offenses are down overall.
Okay.
The arrest rate for African Americans is twice that than what it is for whites for marijuana offenses in Colorado, which is striking. But in terms of incarceration, who's in prison, that incarceration number has been going up for Colorado and for every other legalized state since legalization. So it hasn't reduced the prison population.
Do you have any knowledge as to for what crimes they're being incarcerated for?
So I don't have any knowledge on that. And again, that's not really you can't say, legalized marijuana and population went down or population went up. Simply what we can say is that after legalization of marijuana, there was no noticeable trend downward for any of those legalized states.
Okay, I appreciate that, and I used our good bipartisan friend Google as well, and I did notice. I mean, I was listening to Representative Doucette in your conversation, and just noticing that in Massachusetts, the number one reason for why there's still a thriving black market is cost and convenience. So it does exist up there, and I would anticipate it would also exist here. So I appreciate.
Well, it looks like Google was both good and bad to me today.
Right.
Representative Rojas.
Sorry, not a question, just a comment. I mean, I just want to point out that the marijuana market in Massachusetts is about 3 months old. I think we need to give it a little bit of time before determining whether it's undercutting the black market or not, because quite frankly, it's just too new to make that kind of determination.
And if I may comment, I completely agree with that notion. And that's something our organization has consistently said, which is that we need to, first of all, we should slow down this rush to legalize, and we should watch what's happening in states that have legalized. I think for a state to say, let's rush into legalizing marijuana right now because we're looking at the 8 or 9 states that have for the last 6 years, and it's going great for them, or whatever we may think, I think that's very premature. I think we need to really slow this train down and give these states a good 10 to 20 years, I think, to get full longitudinal data and some real research. We just had our first population level study done in London, the whole city of London, by the Lancet Journal of Psychiatry, foremost institution for research on marijuana's impact on the human brain. And it found that for high potency marijuana users, they are 5 times more likely to develop psychosis. 5 times more likely. Additionally, it found that treatment costs for psychosis in the city of London, so a significantly sized city, would be reduced by 30% if they were to prohibit those potency products from existing at all in the market. So that was a significant find by a research study, but the first population level research study that was done on this new high potency weed. So we've got a long way to go, and we got a lot more research to do, and I think it's very premature to be rushing to legalize marijuana right now, especially in this environment.
Representative Iacarino.
Thank you for the second time. One last question, a follow-up. The Vermont model, did you ever look at that? Has your organization looked how it works there?
So we were involved kind of with that process, and we have an affiliate there, and so we are watching. I think we still need to kind of wait and see because they really just I think it was late last year that they approved that. So we're kind of waiting to see what happens with that. Vermont is the #1 state in the country for I think marijuana use, or one of the top. So it's been a heavy marijuana using state for some time. And that's obviously a concern.
I hike up there quite often, and I don't see it anywhere, to be honest.
Yeah.
I think it's in people's homes,
Yeah.
and that's
Yeah,
their
so
right.
it remains to be seen.
And they do pay a fee to get but it's not, I've gone out to dinner in Brattleboro, I don't smell it, I don't see it.
That's because
And that's my point is, at least if
commercialization,
you're gonna do
right?
something, that's a decent model to start with.
Yeah. Yeah.
Thank you, Mr. Chair.
Thank you. Anyone else? Certainly, we are informed by your testimony, as we are with everyone that comes before this committee. I'll just say that the picture that you've painted today suggests that arrests are not being made in communities around this state and around the country because of illegal marijuana, that billions aren't spent on enforcement, that lives are not negatively impacted by the use of illegal marijuana, that neighborhoods aren't continuing to be disinvested in because of the illegal sale of marijuana. All those things are happening currently. I happen to represent a number of those neighborhoods, and so do a number of members in this room. That's real life today. And you paint a picture as if we legalize marijuana, that's what will happen to our society. I disagree with that perspective, but I appreciate very much, and the committee appreciates the testimony and the insight that you've brought here today. I'll just say that when you've mentioned that that the black market, or the illegal market, as I prefer to call it, has not gone away, well, it hasn't gone away for cigarette sales either, and that's legal and been legal for a long time. If anything, it's increasing, and same with alcohol. Thank you very much.
May I
for
respond?
Please.
So, first of all, far be it from me to make any sort of implication that communities that are suffering at the hand of existing laws are somehow not suffering. I don't think that I anywhere said anything of the sort, and nor would I imply that. Our organization actually advocates for taking away criminal penalties for drug users, not stigmatizing, expungement, looking at ways to help educate the public on the harms of marijuana use, because you know what? If you legalize marijuana, guess what that industry is going to target? That industry is going to target the most vulnerable communities, probably in your backyard, because they're doing it in mine. And they're targeting people who don't know any better, people who are living in communities who are already being targeted by alcohol and tobacco. And now you want to open up the floodgates so Big Tobacco 2.0 marijuana companies can go in and target those industries? No way. That's why I'm here today, is because I'm trying to protect the folks who have been disenfranchised. And there are other ways we can solve those problems. I'm with you on that 100%. But I don't think that we have to open the floodgates so that Altria, owner of Philip Morris and Marlboro, who just put $4 billion into the marijuana industry, can then replicate their model in those communities. They're not helping those communities. It's time we do real things to help, like what this bill's aims are, without opening the doors to this industry. And that's all that I argue for. So I appreciate your concerns, but I do think you've misinterpreted what I've said, because that would never be something that I would advocate for.
Thank you.